If you're over 60, taking supplements might feel like a normal part of your daily routine. But what if I told you that one of the most common supplements in your cabinet could silently be harming your heart? Yes, even something labeled as natural or for energy can actually be triggering heart problems like high blood pressure, irregular heartbeat, or even putting you at risk for a heart attack. And the worst part, most seniors never see it coming. You think you're helping your body, but some of these popular over-the-counter pills can raise calcium levels in your blood, overwork your heart, and even stiffen your arteries over time. In today's video, we'll count down the 5 most dangerous heart-damaging supplements commonly used by seniors, from those advertised to boost brain power to the ones you might be using to strengthen your bones. We'll reveal what science really says and what your doctor may not have warned you about. If you feel tired, dizzy, or experience chest tightness after taking your supplements, it might not be aging. It could be this silent mistake. So stay tuned. What you discover today could protect your heart, your brain, and your life. 5. Calcium supplements without vitamin balance. Many seniors take calcium supplements for bone health, especially to prevent fractures and osteoporosis. But taking high doses of calcium without the proper balance of vitamin D and vitamin K can have serious effects on your heart. When calcium builds up in the blood instead of going into the bones, it can harden your arteries. This condition, known as vascular calcification, makes the blood vessels less flexible. Over time, this increases your risk of high blood pressure, heart attacks, and strokes. It also forces the heart to pump harder, putting extra stress on your cardiovascular system. Seniors with already weakened arteries or previous heart problems are especially at risk. What makes it tricky is that these side effects happen slowly. You may not feel any symptoms at first, but silently, your heart is working harder every day. Calcium from food is much safer because it comes with other nutrients that guide it into the bones. If you're taking calcium in supplement form, it's important to have a proper nutrient balance to prevent this buildup. Always discuss with your doctor before continuing long-term calcium pills. Your goal should be strong bones and a healthy heart, not one at the cost of the other. 4. Energy-boosting supplements with caffeine or stimulants. Many seniors reach for over-the-counter supplements that promise energy, mental clarity, or appetite control. These often contain hidden stimulants like concentrated caffeine, green tea extract, or even guarana. While they might give you a temporary boost, they also increase your heart rate and blood pressure. This can be dangerous for older adults, especially if you have a history of heart disease, irregular heartbeat, or high blood pressure. Stimulants strain your heart muscles and can lead to chest discomfort, rapid heartbeat, and even heart rhythm disorders. Some seniors report feeling anxious, dizzy, or jittery after taking them, warning signs that their cardiovascular system is under pressure. Even so-called natural energy boosters can have these effects when taken regularly or in large doses. Worse, many seniors take them alongside prescription medications, which creates even greater risk. If you find yourself feeling tired often, it's better to look for long-term solutions instead of short-term stimulation. Natural energy comes from better sleep, good nutrition, and proper blood circulation. If you've been feeling tired or out of breath lately and are taking an energy supplement, it's time to pause. Your heart may be silently telling you something important. If you're feeling heart palpitations, poor blood flow, or unusual tiredness, check the link in the description and pinned comment for the Senior Health app. Thousands of seniors already use it to follow safe daily routines that protect their heart, boost energy naturally, and avoid scary health surprises. Don't wait. 3. Highdose Vitamin E. Vitamin E is an antioxidant that supports your immune system and protects your cells. But when taken in high doses, especially above 400 international units daily, it can be harmful to your heart. Some seniors take large amounts of vitamin E, thinking it will prevent memory loss or improve skin. But research shows that excessive intake may increase the risk of heart failure in people with existing heart conditions. It may also thin the blood too much, especially when combined with medications like aspirin or blood pressure medicine, increasing the risk of bleeding. In addition, long-term use of high-dose vitamin E has been linked to a higher risk of stroke, particularly hemorrhagic stroke, which involves bleeding in the brain. Seniors who are already managing blood pressure, cholesterol, or atrial fibrillation may unknowingly increase their risk of complications by taking this supplement daily. The safest way to get vitamin E is through foods like nuts, seeds, and leafy greens. Supplements may be useful, but only in the right amounts and under medical guidance. Taking more is not always better. If you're taking vitamin E capsules every day without checking the dosage, your heart could be paying the price. 2. Omega-3 fish oil in excess. Fish oil supplements are often praised for their benefits to brain and heart health. And yes, in moderation, omega-3 fatty acids can reduce inflammation and support blood vessel function. But more is not always better. Some seniors take high-dose fish oil daily, thinking it will protect their heart. However, too much omega-3 can thin the blood and interfere with clotting. This may increase the risk of bruising, bleeding, and even internal hemorrhaging, especially in those already taking blood thinners or medications for high blood pressure. Some studies have also shown that high doses of omega-3 can increase the risk of irregular heart rhythms in older adults. These arrhythmias can be dangerous, especially if you already have heart disease or a pacemaker. Also, not all fish oil supplements are high quality. Some contain impurities, oxidized oils, or incorrect balances of fatty acids, which can make them more harmful than helpful. The key is balance. A low to moderate dose may support your heart, but anything more than that could tip the scale in the wrong direction. If you are taking fish oil every day, it is important to revisit the dose and quality with your healthcare provider. 1. Iron supplements. Without medical testing, iron is a critical mineral that helps carry oxygen in your blood, but too much iron, especially when taken without medical testing, can severely harm your heart. Many seniors take iron supplements for fatigue or general weakness, believing it helps energy levels. However, unless you have been diagnosed with iron deficiency through blood tests, taking extra iron can cause iron overload. This condition, called hemochromatosis, leads to the buildup of iron in organs like the liver and the heart. Excess iron creates oxidative stress, which damages heart tissue and can lead to heart failure, arrhythmias, and even sudden cardiac arrest. Seniors are particularly at risk because the body's ability to regulate excess iron decreases with age. And since early symptoms mimic normal aging, like tiredness, joint pain, or dizziness, it often goes unnoticed. Iron supplements should only be taken when your doctor confirms low iron levels. Self-medicating with iron is extremely risky. If you are taking a multivitamin with iron daily or a separate iron tablet, it is time to stop and speak with your doctor. Your heart is too important to take chances. Iron is helpful only when you truly need it. Otherwise, it can quietly destroy the very organ you are trying to protect. Your heart is not just another muscle, it is your lifeline. And while supplements can support health in many ways, the wrong supplement taken at the wrong time can silently do damage. Seniors often trust these pills without realizing how powerfully they affect the cardiovascular system. If you've been experiencing unusual tiredness, shortness of breath, chest discomfort, or palpitations, do not ignore those signs. What seems small now could turn into a serious heart condition later. That's why it is so important to stay informed, cautious, and proactive. You do not have to figure it out alone. There is a simple tool that many seniors are already using daily to stay safe and follow the right routines. Check the link in the description and pinned comment for the Senior Health app. It helps you avoid the wrong supplements, Track warning signs and protect your heart health starting today. And always, before making any changes to your supplement routine or starting anything new, speak to your doctor. They know your health history best and can guide you in the safest way possible. Your heart deserves your full care because it has cared for you your whole life.